Hi, I'm Lorraine, owner of pregnancyexercise.co.nz, and in this video I'm going to show you and teach you how to correctly activate your transverse abdominal muscle, or TVA for short. What I want you to do is lie down on your back, nice and relaxed through the shoulders, okay, knees are bent. Place your hands or two fingers in this position on your hips, so just lower than your hip bones. What I want you to do is cough or laugh, and what you should feel is two little muscle bands pop up underneath your fingers. Now you can start to do this exercise 3 to 5 days after giving birth, but don't worry if you can't feel those bands pop up just yet. If you keep trying, within 2 to 3 days you'll soon feel these muscles start to activate again. Okay, so once you've coughed, you should be able to feel where the muscles are. Now I'm 12 weeks post-pregnant and I've been following my 12-week program, so I'm quite strong now through these muscles. So to activate them correctly, you draw your belly button down towards your spine, and you should feel those muscles just slightly pop up underneath your fingertips. Now, this is done wrong numerous times, okay? What I don't want to see is you pulling in really hard and you're activating your upper abdominals, and also what sometimes occurs is you start to lift with your shoulders. You must try and keep all the muscle groups and the rest of your body above your belly button relaxed. Once you can activate your transverse abdominal, so I'll draw my belly button in, activate those muscles, and I can keep breathing whilst I can still feel the muscles active. Now once you can do that for 30 seconds, then you can move on to the second exercise, which is leg slides. So you can slide your legs down, keeping the rest of your body nice and relaxed whilst you've still got your TVAs engaged and activated. Now as you can see, I'm not increasing the arch in my back, neither am I flattening my back too much. If you do either of these, if you find that you're arching your back, you're using your back muscles too much. If you're pushing your back down into the floor, you start to work the upper body muscles, your upper abdominals. So it's important that you keep in a nice neutral spine. Now, if you find that exercise too hard and you can't feel the abdominal muscles activating, come over into a 4-point kneeling position. So hands shoulder width apart, maintain neutral spine, feet, knees are hip width apart. And what you're going to do this time is completely relax your stomach muscles and then draw your belly button up towards your spine and hold that connection for 10 to 15 seconds. Now that gives you a lot more muscle feedback doing it in this position. So you relax your belly, your abdominals down, so relax your tummy down, draw your belly button in, and what I suggest you do is draw it in for 5 seconds, hold it for 5 seconds, and then relax for 5 seconds. So you can do that activation of those transverse abdominal muscles 3 to 5 days after giving birth, and the more you do them, the more you feel them, and then hopefully we're going to prevent any lower back pain caused by post-pregnancy. So if you've not checked out my video on diastasis recti, have a look at that video to test your abdominal separation, and then start doing this exercise today. And don't forget to have a look at the 12-week post-pregnancy exercise program on my website. Thanks.